Right now, while most people have welcomed the end of the country's mask mandate, few are still hesitant to let them go. Health Minister Dr. Phaahla repealed the country's COVID-19 regulations after a steep drop in COVID-19 infections. Meanwhile, a study published in The Lancet shows that vaccines prevented an estimated 19.8 million deaths from the virus. But what is the current status when it comes to the pandemic? And are there reports of new variant elsewhere in the world? For this, we're joined by Professor Tulio de Oliveira, Director of the Center for Epidemic Response and Innovation. He joins us now virtually. Professor, thank you very much for your time here on All Angles. Just first of all, are we too relaxed in South Africa? I mean, at some point this past weekend, I traveled and I was in a plane and they were telling us about social distancing and telling us that we would disembark a row at a time, but the plane was full to capacity. So if there was COVID-19 there, we definitely all got it. Are we too relaxed?
Yeah, first, good day, Marcelo, and to all your viewers. Yeah, I don't think that we are too relaxed. I think that we are going back to normal life. I think that was more than needed, yeah, after 2.5 years of the pandemic. And we are also following the regulations, not only in South Africa, but recently I have traveled around the world to Germany, to Sweden, to Brazil. And it's quite common in both of in these three countries, in two different continents. The vaccine mandate is no one's asking for proof of vaccination or even testing. I think that at the moment we are just going back to normal life, and I think that at the moment that's the appropriate.
I think a lot of us would actually agree that we needed to just go back to normal life. Now, Prof, tell me, according to any of the studies that you've been doing recently, we know that in South Africa, at least, our numbers are going down and that we are not, there's no alarm, there's not too much worry in terms of the statistics there. But how's it looking in other countries, perhaps in Africa and around the world?
So at the moment, yeah, there is a slightly uptick of infections in other countries in the world, more specifically in the United States of America and some European countries. But that is exactly the same variant or the subvariant, the BA4 and BA5 that we discovered in South Africa that caused our recent resurgence. So what it's happened is that this variant is spreading around the world, but we are seeing very similar around the world what we saw in South Africa, what was the fifth wave, yeah, with like infections going high, but not going very high, neither hospitalization or deaths.
And lastly, it's still okay for us to as you said, go back to normal. I think a lot of people around the world, not just us, are quite fatigued by even talking about COVID, especially after the havoc that it wreaked across many parts of the world. But according to you, Prof, are we safe now? Will we never have to talk about this virus again, except just to remember those horrific 2 years?
So first, we do not know. Yeah, what we know is that we are in an interwave period, yeah, with no signs of infections increasing. And that is correct, at my personal view, to be in the very low restrictions or no restriction, yeah. If in the next few months, yeah, if another wave or another variant will emerge, the right answer is that we do not know, but one thing that we know is that we are much better prepared to deal with this virus from, for example, in South Africa, we have very high population immunity to vaccination and previous infections. And I think key, if there is signs of a new variant emerging, yeah, would be just to boost the population before that happen, yeah. And I expect that would be the case, yeah. Of course, South Africa has very, very advanced genomic surveillance. We are some of the most advanced genomic surveillance groups in the world. Yeah, we are also in very clear communication in our government. And at the moment, we do expect things to become much better and hopefully to stay there, and that the pandemic is just a memory in our life, a very bad memory. We lost many people that we love. Yeah, and that's what we expect at the moment. But this virus surprises us many times, and that's why, as scientists, we still should be alert and make sure that we are tracking very well the evolution of the virus, which we are doing.
Well, thank you very much for speaking to us, Professor Tulio de Oliveira. He's the director of the Center for Epidemic Response and Innovation, and I'm sure you're just as happy as I am about what he said in terms of us having COVID-19 as a memory, a bad one at that, but at least with other problems that we're facing as a country, we can have COVID-19 as one of those problems that we can put on the side.